Good evening and welcome, everyone. Thank you for joining William Osler Health System's Telephone Town Hall. My name is Gurjeet Gorbans, and I am a member of Osler's Patient and Family Advisory Council. I'm delighted to be back moderating Osler's Telephone Town Hall this evening. One of the reasons I joined Osler's Patient and Family Advisory Council was to share my experiences and insights as we all work together to improve healthcare in our community. I'm pleased to see Osler's continued commitment to meaningful two-way communication with the community, and I'm proud to be a part of it. Our hospitals have always played a vital role in our communities, but since the start of the pandemic over 2 years ago, their role has been more important than ever. Tonight, Osler's senior leaders will share the latest updates on the hospital's COVID-19 recovery efforts and the exciting transformation of Peel Memorial into Brampton's new hospital. They will also provide updates on the future of hospital services, Osler's visitor policy, and more. What we are looking forward to the most, however, is hearing from you. From my experience as a volunteer patient and family advisor with Osler, I know our hospital leaders are committed to listening to and learning from all of us. Throughout this evening's town hall, I will also be asking you a few polling questions, which you can easily respond to using your phone. I will provide more details on how to do this shortly. It's now my pleasure to introduce the Osler senior leaders joining us this evening. Linda Franklin, first chair, Osler's Board of Directors. Dr. Frank Martino, interim president and CEO at Osler. Kiki Ferrari, chief operating officer at Osler. Ann Ford, executive vice president, strategy and corporate services at Osler. And Ken Mayhew, president and CEO of Osler Foundation. As I mentioned before, over the next hour, you will have several chances to ask questions. To be placed in the queue to ask a question, please press *3 on your phone at any time. We will get to as many questions as we can, both on the phone and questions that have been submitted through Osler's website in advance of today's call. For those callers that we cannot respond to, I will provide instructions at the end of the call on how to leave your question with us so Osler can get back to you. For those of you who are just joining us, welcome to William Osler Health System's Telephone Town Hall. I would now like to invite Linda Franklin, first vice chair of Osler's Board of Directors, to say a few words.
Well, thank you so much, Gurjeet, and good evening, everyone. I am really honored to be part of tonight's event and to be able to be here to speak with you all. I currently serve as first vice chair and member of the Executive and Health Services and Quality Committees of the board. I'm really delighted to be part of this town hall because it's an opportunity to connect with our community, and these are tremendously important discussions. As a member of the board of directors, it means a lot to me to have open and transparent communications with the community, and I sincerely thank you all for joining us here tonight. Before my colleagues share their updates, I do want to express the pride that I have in Osler. Since I joined Osler's board of directors in 2017, I have witnessed firsthand the outstanding dedication that our healthcare teams and leadership have shown daily. I've also seen how, over the past 2 years, Osler's dedicated staff, physicians, volunteers, and you, the members of our community, coming together in incredible ways to ensure patients continue to have access to high-quality, compassionate care. So on behalf of the entire Osler board, I want to extend gratitude to the staff, physicians, and volunteers for their commitment, especially through the challenges of the COVID-19 pandemic. Their shared resilience has united us and made us stronger as a local health system and as a community. They've truly helped us to be Osler strong, and I'm so excited for all that's ahead in the coming months and years. I will now pass it back to Gurjeet. Thanks so much.
Thank you for your kind words and for your leadership, Linda. For those of you who have just joined, if you would like to ask a question or make a comment, press *3 on your phone. This will bring you into the question queue to speak with one of Osler's leaders. We kindly ask that you keep your question brief so that we can get to as many as possible. I would now like to ask Dr. Frank Martino, Osler's interim president and CEO, to say a few words.
Thank you, Gurjeet. I'm so happy to have you with us again tonight as the host of this important meeting. Good evening, everyone. I hope you're all staying safe and healthy. We hope that our spring weather is soon around the corner. I know that those showers are outside, but remember, they've come a little late, but there is the promise of Mayflowers just around the corner. I'm Dr. Frank Martino, Osler's interim president and CEO. And for those of you who don't know me, I practiced family medicine in Brampton for more than 30 years. I also continue to practice obstetrics at the Brampton Civic site as well. I work in the emergency department at both the Civic, Etobicoke General, as well as the Urgent Care Center here at Peel Memorial. I've also held the chief of staff position at Osler for many years, and I'm truly honored to lead Osler during this exciting time. Since our last telephone town hall in December, Osler healthcare teams have been working diligently on our COVID-19 recovery. We've been advancing the transformation of Peel Memorial into Brampton's new hospital, and we've been planning for the future of services across our site, including at Brampton Civic and at Etobicoke General, all while ensuring patients in the community receive quality and compassionate care. We'd like to take some time to update you on these developments and, of course, take your questions and also listen to your comments. As one of the hospitals hardest hit by the pandemic in Ontario, we knew our recovery would likely take a bit longer than some of other hospitals or regions in the province. Osler is still feeling the impact of previous COVID-19 waves, and with the virus still circulating in the community, we must remain ready to respond in the event of an increase in COVID-19 activity. I know my colleague Kiki Ferrari will speak more about this shortly. We are now in the sixth wave of the pandemic. Osler continues to see a lower but steady number of COVID-19 patients than in previous waves, but we need to continue to do everything we can to keep ourselves and each other safe. We know that when the community works together, we save lives, and we thank you for doing your part, following safety protocols, rolling up your sleeves to get the vaccine, and importantly, your booster. As we look towards the future, this really is an exciting time for Osler and for healthcare. Over the past few weeks, Osler has been part of some very important government announcements that will benefit our community. Number one, a month ago, the provincial government announced $21 million in new funding that will support our continued planning of the new Peel Memorial Hospital. This new funding also enables Osler to continue plans to expand cancer services at Brampton Civic Hospital, including radiation treatment that is currently not available in our community. Many may not know that a patient with cancer requiring radiation therapy often has to go on a daily basis to a facility that provides radiation therapy. That can be difficult if it is distant from your home. Ann Ford, Osler's Executive Vice President of Strategy and Corporate Services, will provide more details on these important projects later on our call. Number two, a few weeks ago, Brampton City Council ratified an unprecedented $125 million contribution to Osler's redevelopment projects. As expressed in our letter to the community shared recently, this is a huge milestone for healthcare in the Brampton community and really demonstrates the commitment of our municipal government partners to advance healthcare infrastructure. We are profoundly grateful to Mayor Brown and Deputy Mayors Pat Fortini and Martin Medeiros and Brampton City Council and residents for the continued support. And number three, also to note, in March, we joined the newly named Toronto Metropolitan University, formerly known as Ryerson University, and Premier Ford for an announcement about a new medical school to be located in Brampton. Osler has a strong history of supporting physician-clinician training, and a new medical school really represents an exciting new opportunity to train more clinicians and physicians of the future. And we hope that many of these will settle within our catchment area and provide care to our patients. Before I turn things back to Gurjeet, I want to assure you that at Osler, we continue to navigate the ongoing COVID-19 pandemic. We're here to take care of you and your family. It will take time for Osler to get back to our usual capacity for surgeries and procedures, but we're committed to delivering exceptional care to this community. We are thankful for our staff, physicians, volunteers, and our partners who have worked tirelessly to care for our patients. We're also grateful for your support. The uplifting messages we receive are so appreciated by our teams. I want to tell you a bit about a mother and daughter who I encountered the other day. As many of you may recall, patients started to place small stones painted with messages for our healthcare providers early on in the pandemic. I saw this mother and daughter. They'd taken those stones and refreshed the paint and the messaging and placed them along the path for our staff to view as they entered our hospital. That really was touching. Anyhow, thank you again for joining us tonight. I'll now hand things back to Gurjeet.
Thank you, Dr. Martino. For those of you who have just joined us, if you would like to ask a question or make a comment, press *3 on your phone. This will bring you into the question queue to speak with one of Osler's leaders. We kindly ask that you keep your question brief so that we can get to as many as possible. I would now like to ask Tiki Ferrari, Osler's Chief Operating Officer, to share some additional Osler updates.
Thank you, Gurjeet. Good evening, everyone. I'm glad to be here tonight for another telephone town hall and to connect with you once again. With COVID-19 numbers and hospitalizations declining earlier in the year, we were so pleased to reopen our Urgent Care Center, or UCC as we call it, at Peel Memorial in March. As many of you may know, the UCC is an important service that is resourced with emergency-trained staff and physicians ready to provide care for immediate but non-life-threatening conditions. Plans to expand the UCC to 24/7 operations later this year continue, and this will set the stage for our second full emergency department in Brampton when we open the next phase of Peel Memorial. As Dr. Martino mentioned, COVID-19 is still circulating in our community. For Osler, this means that we continue to have staffing challenges across our hospitals. Since Directive Number 2, which required that all non-emergent or non-urgent surgeries and procedures be paused to help preserve system capacity, was lifted by the province in February, Osler has been working hard to safely recover services that were previously paused, including non-emergent procedures and surgeries. We are now performing hundreds of these surgeries every week that have been prioritized according to acuity, which means how sick someone is. And of course, we are also doing many emergency surgeries. I want to reiterate that although our recovery may take a bit longer than other hospitals, we are continuously assessing the situation and doing our best to resume all services as soon as possible. Switching gears, this week is the Canadian Mental Health Association's 71st Annual Mental Health Week, and I would like to take a moment to share some of the great advancements within Osler's mental health program. In line with our vision to provide patient-inspired healthcare without boundaries, shortly after the onset of the pandemic, Osler's mental health team launched a number of virtual programs to help ensure people in our communities continue to have access to the mental health services they need. Osler's virtual step care program is one example of a program that transitioned smoothly to a virtual platform and helped us to maintain short wait times to see a psychiatrist and to receive treatment. We are fortunate to have the shortest wait times amongst our regional peer hospitals for this. We also have some good news about renal services at Etobicoke General Hospital. Osler's Etobicoke Renal Center is celebrating its 2-year anniversary of providing dialysis and care closer to home for those in the communities served by Etobicoke General. When the Etobicoke Renal Center first opened in June 2020, we launched 15 hemodialysis stations that are vital in managing the needs and safety of dialysis patients. Since 2020, we have grown to 24 hemodialysis stations and see up to 72 patients a day 6 days a week. With the addition of these services, dialysis patients in the North Etobicoke community are able to receive the care they need closer to home. I'm also proud to share that recently, Osler was nationally recognized by the Canadian College of Health Leaders for its unwavering commitment to safe, quality care as the recipient of the prestigious 2022 Excellence in Patient Safety Award. This is especially commendable for a team who, despite being in a hotspot of COVID activity, never lost sight of safety. At Osler, patient safety is at the heart of everything we do, and awards like these really highlight the values of our staff and physicians and show the culture of collaboration here at Osler. If you are interested in a rewarding career and joining a truly innovative team, we are hiring for many positions. Just a few weeks ago, we held a virtual career fair, and we were pleased with the engagement from new graduates and individuals who were drawn to our amazing organization. Lastly, I want to thank you for the encouragement you have provided our healthcare teams over the past year. We are truly lucky to have an engaged and supportive community. I will now pass it back to Gurjeet.
Thank you, Kiki. As I mentioned earlier, we will be asking you a few polling questions this evening to invite your input on some topics of interest. First, we'd like to know, how would you and or others like to find out more about job opportunities at Osler? Press 1 if your answer is through social media. Press 2 if your answer is through online job boards such as LinkedIn or Indeed. Press 3 if your answer is through Osler's website. Press 4 if your answer is through local papers or TV programs. The question again is, how would you and or others like to find out more about job opportunities at Osler? Press 1 if your answer is through social media. Press 2 if your answer is through online job boards such as LinkedIn or Indeed. Press 3 if your answer is through Osler's website. Or press 4 if your answer is through local papers or TV programs. Please enter your response on your phone now. I will share the results shortly. We will now begin to take your questions. For those of you who have just joined the telephone town hall, if you would like to ask a question or make a comment, press *3 on your phone. This will bring you to the question queue to speak to one of Osler's leaders. We kindly ask that you keep your question brief so that we can get to as many as possible. We will now begin taking your questions. Our first question is from Mona on the phone. Mona?
Hello? Can you hear me?
Yes, we can hear you. Hi, Mona.
Good evening. Thank you for taking my question. I just will tell you my background. I'm a retired vice principal of a school in Peel, very active in the city of Brampton in many categories, supporting seniors and youth. And my question, though, has to be with visiting. How is Osler Healthcare Center planning to treat unvaccinated people who are all tested negative? If we would like to visit to support others at hospital and we're all tested negative, how would you treat us who are unvaccinated? Thank you for taking the time to answer.
Mona, thank you very much for your question, and thank you for everything you're doing in our community. For visits in the hospital, if you're visiting someone who's receiving care in the hospital, we have a screening process at the front door, but unvaccinated people cannot visit anyone in the hospital right now as COVID is still circulating. However, we do have exceptions to that policy, and it depends if someone, for instance, is having a baby. It depends on if they're end-of-life care. There's very, very specific and detailed information you can find on our website, williamoslerhs.ca. that you speak to the patient, who will often know what the visitor policy is, or refer to that website. But I want to underline again that anybody can receive care at Osler, whether they're vaccinated or not.
Thank you, Kiki. Our next question comes from Terry, and it's from our online question. Terry asks, by what date will the new full-service Peel Memorial Hospital accept its first acute care patient? And that question I'll pass on to Anne.
Thanks, Terry, for that question. To date, Osler has completed its second phase of functional programming and submitted that to the Ministry of Health back in January of this year. And we have more stages of planning and approvals ahead under the Ontario government capital planning process. We anticipate through all that planning that construction will actually begin towards the end of 2023 with substantial completion of the project in 2027. It seems like a long time, but this is a very large building, and it will take us probably 36 to 48 months to construct. The new emergency department, combined with our multi-story new Peel Memorial Hospital, will significantly boost our services for patients in Brampton and the surrounding areas. And acute care patients will be seen at the emergency department when the new Peel Memorial opens. They will both open at the same time. I think as folks can understand, as with most construction projects, dates are subject to change, but at this time, we are hopeful that we can welcome our first acute care patients through the doors at the new Peel Memorial in 2027. Thanks for your question, Terry.
Thanks, Anne. Our next question is from online as well, from Carl. And Carl asks, there appears to be confusion relating to the funding of Peel Memorial. The Ontario government quotes one figure, the Mayor of Brampton quotes another. I'm confused. What is the reality? Anne?
Thanks, Carl, for this question. It can be very confusing at these early stages of planning. The Peel Phase 2 project is included in Infrastructure Ontario's 2022 market update, which reflects the current status and the anticipated cost of the project, which right now is between $500 million and $1 billion for the project. The total capital cost of the Peel Memorial Hospital is estimated based on a number of factors, some including the square footage of the building, the type of space being planned, which is associated with the type of patients that will be seen within the facility. We have engaged a professional cost consulting team to provide these costings, and the final cost of the build will be determined by the market when we go out in one of our later stages of procurement and a request for proposal in 2023.
Thank you, Anne. Our next question comes from Jamie, who's joining us on the phone. Hello, Jamie. Go ahead with your question.
Hello, everybody. Thank you for taking my call. I just have two quick questions. One question would be is that living in Brampton here for the past 40 years now, I'd like to know what steps are being taken to speed up patients to be treated by physicians here, because at the hospitals, when you go to the hospitals, you're waiting, 4 and 5 hours, sometimes even longer to be treated by, to be seen by a physician.
I'll pass that question on to Kiki.
Thank you very much, Jamie, for your question. In terms of seeing a physician, it depends what type of care you are needing. First of all, if you go to our emergency department, our wait times have improved considerably. And in fact, we have some of the best wait times now for specific patients. At EGH, we have the best wait times to see a physician in the province. We understand, though, it sometimes can be frustrating with COVID. There has been an increased strain on the system, and sometimes because of screening processes and the availability of staff, you might have to wait a little bit longer on particular days. In terms of seeing a physician for surgery and other specialties, your primary care physician can refer you to any specific specialist. We, in fact, are doing our best to try to reduce our wait list. We ask that if you're on a wait list waiting for a patient that, waiting for a procedure rather, that you please contact your physician to see where you are in the wait list. If your symptoms have changed or the need for surgery has changed, please make sure that you're connecting with your primary care physician. We also have an excellent tool. If people want to come to the ED and want to know what our wait time is, we now have an electronic ED wait clock available on our website, williamoslerhs.ca. Please use that tool in advance, but never use that tool if you're in an emergency situation and have serious issues. Call 911 and don't worry about that wait time. Thank you for your question, Jamie.
Jamie, you said that you had another quick question as well. Jamie? Okay, we'll go next to Elizabeth, who is also joining us on the phone. Elizabeth, hello. Go ahead with your question. Hi, Elizabeth. Go ahead with your question. Our next question then will go on to Raj. Raj is joining us. Oh, Raj has submitted an online question, and the question is, other than the UCC, what other services are available at Peel Memorial at this time? I'll pass that question on to Kiki. Thank you, Kiki.
Raj, excellent question. First of all, outside of the UCC, we also do some surgical procedures, day surgeries, such as cataract surgeries, for instance. We have a dialysis unit. We also have diagnostic imaging. We have mental health services and women and children's clinics at our site. And these clinics help to provide better access to care. And going back to Jamie's question about accessing a physician, these clinics really help you to see a specialist a lot quicker. And a lot of them now also have virtual care, which is a great option for care where you don't have to leave the comfort of your home to access care. A good example of that is our virtual emergency department, where information is also available on our website on how to access that.
Thank you, Kiki. We'll now go to, we'd now like to announce the results of our first polling question. And our question was, how would you and or others like to find out more about job opportunities at Osler? 16% of respondents said through social media. 20% of respondents said through online job boards such as LinkedIn or Indeed. 36% of the respondents said through Osler's website. And 28% said through local papers and TV programs. Thank you for this helpful input. Your ideas and feedback are always important to us. I would now like to ask another Osler leader to share further updates. Ann Ford, our Executive Vice President of Strategy and Corporate Services, will share the latest on Osler's redevelopment projects.
Thank you, Gurjeet, and good evening, everyone. I'm happy to be back. I'm Ann Ford, our EVP for Strategy and Corporate Services, and I'm pleased to be here to provide you with an update on the new Peel Memorial Hospital, as well as some other important projects we have with our hospital services. As Dr. Martino mentioned earlier, the provincial government's announcement of $21 million in funding for Osler was a fantastic announcement and a huge milestone for our community, as it will help Osler plan and build the future of our hospital services throughout our region. These new funds include $18 million to support more detailed planning and design work for the transformation of Peel Memorial into Brampton's new hospital and a new large emergency department. Our plans for the new hospital include the construction, as I mentioned, of a new multi-story tower with 250 inpatient beds and room for more beds in the future. New and expanded outpatient services and day programs, and as I mentioned, a second emergency department for Brampton. These plans will significantly increase the healthcare capacity in the region for years to come. And actually that increase is 40%, an additional 40% of inpatient beds across the Osler health system. And it will provide this and support for growth of more robust and accessible services and our health system. Combined with the numerous outpatient clinics, the diagnostic imaging, our surgical suites, and other healthcare services already operating on the Peel Memorial site, the new Peel Memorial will create more services for our community. If you visit our website, and I encourage you to do so, you will see a page dedicated to this project with further details on the project. This website is updated regularly, and you can visit more than once. There's also a survey, and if you haven't already, please take a minute and fill it out, as your feedback really helps inform our planning and design of this building, and we really look forward to your feedback. The provincial government's announcement in early April also enables Osler to continue its plans for enhanced cancer services at Brampton Civic Hospital, including radiation treatment that is not currently available in our community. As the needs for cancer care and treatment continue to increase across our region, this is much welcome news from the provincial government. And as the population of Brampton and our surrounding region, including Caledon and other areas, we know these projects are critical to help ensure that we can continue to provide you with the health services that we and the community needs the most. Thank you so much for attending this evening, and I look forward to answering any questions you may have. I'll now hand it back to you, Gurjeet.
Thank you, Anne. We would now like to ask our second polling question. To answer the question, please press the number on your phone that corresponds with your answer. Our second question is, what is the main way you would like to receive information about hospital updates, such as the new Peel Memorial? Press 1 if your answer is through more telephone town hall virtual events like this one. Press 2 if your answer is through information on Ostler's website or social media accounts. Press 3 if your answer is through information available at the hospital when I'm there. Or press 4 if your answer is through mail out to my home. I'll ask the question again. What is the main way you would like to receive information about hospital updates such as the new Peel Memorial? Press 1 if your answer is through more telephone town hall virtual events like this one. Press 2 if your answer is through information on Ostler's website or social media accounts. Press 3 if your answer is through information available at the hospital when I'm there. Or press 4 if your answer is through mail out to my home. We would like to open the line to answer more of your questions. Please press *3 on your phone to bring you into the question queue and speak with Ostler's leaders. Again, we kindly ask that you keep your questions brief so that we can get to as many as possible. Our next question is from Parminder. Hello, Parminder. Please go ahead with your question.
Hi, everyone. So thanks for giving me a time to speak up and bring out my thoughts. First of all, I want to explain myself a little bit because I'm a nurse as well. So serving in my community, not in Brampton, but in Toronto. So just want to just bring one question that is really frustrating when we go to hospital. Like if you know something that you can figure out what is going on, but otherwise if you don't know anything, they don't give you a time to explain to yourself. Recently, one of my friends, I refer her to Peel Memorial. She was like in a traumatic accident, and the son had a fractured finger. So they just give her an answer, oh, it's a very long waiting time. If you can sit and wait, then it's up to you. Either you want to go or you just have to go to another hospital. So this is not the answer that as a community we give to someone. As a nurse, I will never ever give that answer to anyone. Nobody wants to come to the hospital. We come to the hospital. I know some people come for a minor things, but we always come to hospital when everything is out of our control, when our primary physician can't do anything, when we know that treatment can be done in the hospital setting only. And when you go over there, you have a long waiting time. Not all people have the same circumstances that somebody is there to take care of their other children. So my request is how we can just deal with this long waiting time, and how we all level of municipality, or how we can bring out our voices so that our voices can be heard. We only have one full serving hospital in Brampton, even though Mississauga has two.
Thank you, Parminder. I'll pass that question on to Kiki.
Thank you very much, Parminder. Thank you. I can sense the passion in your voice, and I'm very sorry for the experience that yourself and your family members had. We're always trying to improve the care that we provide, and with that, we've taken on a number of different things to help improve our wait time, including opening the UCC 24/7 in the fall. We have virtual emergency care to help to alleviate some of the pressure in the emergency department. And we're also obviously looking to build a second ED at our Peel site in the future when we build Peel Phase 2. I think it's very important for you to know that the UCC staff are emergency department trained, and they have the best wait time in the province, faster than even our emergency departments. And across the province, since COVID has started, there has been a lot of strain on the system, and the wait times have increased overall. It's mostly due to the fact that it's very difficult. While other people are getting sick with COVID, our staff are getting sick with COVID, which puts additional pressure on the system. But having said that, when you're inside the emergency department and you're waiting, it doesn't feel very good. And we acknowledge that, and we hope to do better for you in the future. I hope you will give us another chance to take care of you and your family and to do better.
Thank you, Kiki. Our next question comes from Ms. Henry on the phone. Hello, Ms. Henry. Go ahead with your question.
Hello. Thank you for taking my call. My question is, I live in Etobicoke, and this is like about the third time I've been on a call of this setting, and I constantly hear what's happening in Brampton, what's new happening in Brampton. I would like to know what is new that will be happening in Etobicoke, basically Etobicoke General. And that's my question. Thank you.
Thank you, Ms. Henry. I'll pass that question on to Anne.
Good evening, Ms. Henry, and thank you for your important question. As you may know, we have built two new buildings at Etobicoke General since 2018, one being a building that houses multiple outpatient clinics, including our fracture clinic and some diagnostic imaging, along with dialysis, as Kiki had mentioned earlier. And we opened a new inpatient wing at Etobicoke, which includes our new emergency department, women's and children's, including a neonatal ICU, and critical care beds. So we've done that work within the last few years. Additionally, we continue to complete some internal renovations to support the addition of inpatient beds, and are in discussions with the Ministry of Health currently regarding the development of additional critical care beds within our new wing. With the completion of the new wing, we have and are beginning discussions internally regarding the next stages of large-scale redevelopment on that site. as we know that our current patient tower is coming up on 50 years old. So we have done quite a bit of work on Etobicoke, and we will continue to do so over the next coming years. Thank you for your question.
Thank you, Anne. I'd like to now announce the results from our second polling question. Our second question was, what is the main way you would like to receive information about hospital updates, such as the new Peel Memorial? 35% of the respondents said through more telephone town hall virtual events like this one. 18% said through information on Ostler's website or social media accounts. 4% said through information available at the hospital when I'm there. And 43% said through mail-outs at my home. Thank you for this helpful input. We'd like to now continue to answer more of your questions. Please press *3 on your phone to bring you into the question queue and speak with Ostler's leaders. Again, we kindly ask that you keep your question brief so that we can get to as many as possible. Our next question is from June, and June is joining us on the phone. Hello, June. Please go ahead.
Hi, thank you for taking my question. I actually have two quick questions. My first one is, if you've tested positive after taking the rapid test, how soon after you get a negative result can you go out? And also, I am an 8-year cancer conqueror, and I had my chemotherapy and surgery at William Osler, and I had to make the trek to Credit Valley for my radiation. I know there's been talk about expanding the oncology unit to put radiation machines in. I'm wondering if somebody could just expand on that a little bit.
Sure. I'm going to pass this question on to Frank to answer for you.
Hi, June. I'm so pleased that you're now 8 years past your cancer diagnosis. Congratulations. Radiation therapy is extremely important for cancer patients, and in collaboration with Ontario Health and Cancer Care Ontario, it has become clear that various regions throughout the province will require enhanced services in radiation oncology, and that's, radiation therapy, very much what you received. At present, our patients are going to Trillium. They're also going to Princess Margaret and Sunnybrook. Those centers are dealing with significant capacity issues, and through the wise counsel of Cancer Care Ontario and Ontario Health, we've decided that this region requires more radiation oncology bunkers. Those are the centers where you receive that therapy. And Osler is slated to get a number of these radiation oncology linear accelerators that provide that therapy. Our plan is to put that on the Brampton Civic site, on the southeast corner of that site, and enhance it not only with radiation bunkers, but enhance our systemic therapy, enhance our research, enhance the clinics that are provided for our patients. That's part of what many would envision a regional cancer center, and that is our hope, that we will become a regional cancer center. So we look forward to that, and we're planning actively now with a grant from the Ontario government to actually do that. With regards to your second question regarding, I'm pleased that you tested. It's important that people on the line know that if you're symptomatic with symptoms typical of a respiratory infection, that could be COVID-19 or Omicron or the Omicron variant, that you do test. And if your test is positive, a lot depends on whether you're symptomatic or not. I encourage you to get more definitive answers by contacting public health. Also speaking to occupational health if your employer has one of those departments. But generally speaking, if you're not symptomatic, isolation is for about 5 days. If you are symptomatic, it should be a minimum of 10 days. I hope that answers your question, June.
Thank you, Frank. Our next question comes from Marianne Wong, who is also joining us on the phone. Hello, Marianne. Go ahead with your question.
Yes, I'd just like to give you a background that I am a retired nurse and was recently in the hospital at William Osler on the cardiac care unit. I'd like to know why there's money to develop more clinics and this sort of thing, but there doesn't appear to be enough money for William Osler to supply sheets without holes in them, of being in the hospital for up to 4 days, and there's people in the rooms. Nobody has pillows. There's not enough wheelchairs. People, when they're discharged from the cardiac unit, have to walk all the way down to the front. There's not enough wheelchairs. And as part of that is how can we, as the people within the community, get involved with overseeing the standards and where things are spent and what is needed for the hospital to function at above a poor country status for not having appropriate equipment.
Thank you, Marianne. I'll ask Ken to answer your question for you.
Thank you very much for your question, Marianne, and thank you as well for sharing your experience with us in our hospital. As you may well be aware, given your medical background, 100% of the equipment inside of our hospitals is in fact funded by the community. So there are ongoing efforts underway to help address the sort of shortages that you talked about in terms of wheelchairs and stretchers and linens and those sort of things. And at the same time, as my colleague Anne mentioned, we are a growing community, a rapidly growing community, so we also have to plan for the future, and that will require enhanced cancer care and also the additional beds that Field Memorial Hospital will make possible. So we're sort of seeking to concurrently do both things, but I certainly appreciate your concerns. We seek to do the very best that we can as a staff team, and we'll note your concern, and I very much appreciate your question. Thank you.
Thank you, Ken. Our next question comes from Zonette, and I apologize if I've mispronounced your name, who is joining us on the phone. Go ahead, please.
Hello, this is Donette. I am a PSW for over 35 years in Brampton, Peel region, and recently my mom has been diagnosed with cancer, and she has to go in for, different appointments here and there and everywhere. She was also a PSW in the community. Now, when we go in with her, they are refusing us to go anywhere with her in the hospital, which is in Brampton. She goes to these appointments. We're anxiously waiting for her to come back and tell us what happened. She can't remember. There's so much information that she's been given. She can't remember anything. She's just overwhelmed. Now, how is this going to ever change for myself or other people with their family? We're not just going in there to hang out. We want to know what's going on. Now, in our case, she can't remember anything to tell us. Now, how do we fix this?
Thank you for your question. I'll pass that on to Kiki.
Thank you, Gurjeet, and thank you very much, Zanette, for your question. I'm very sorry to hear that your mother has cancer, and it's so important to have family support, and we recognize the importance of family and essential care providers in helping with the care of the patient when they do consent to that. In our visitation policy for outpatients, we do allow exceptions for physical, cognitive, or any developmental disability, but also one essential care partner may accompany an outpatient during their scheduled appointment and procedure. And to be essential care partner, and you can actually talk to the physician and or the primary nurse or care team, and they can let you know how you have to prepare if you are an essential care provider. And it means you have to mask and do different things when you do come into the hospital. But there's definitely a way to help your mom in that situation. We also have virtual care options that are available that can be helpful as well in terms of speaking to the physicians when the patient, or in this case your mom, consents to have that discussion with the physician. So thank you very much, and I really wish your mom the best of luck.
Thank you, Kiki. Our next question comes from Maureen, who is also joining us on the phone. Hello and welcome. Please go ahead with your question.
My question deals with the possibility of having bold signage in lobby areas at both buildings at William Osler, indicating where to get a blood test. The one at Etobicoke General Hospital here in Rexdale. Well, that one, I was there and I was sent to both buildings. So if you can have a signage in the lobby areas for people requesting blood tests to know exactly which building gives blood tests.
Thank you, Maureen. I'll pass that question on to Anne.
Good evening, Maureen. Thank you for your question, and my apologies if you were taken to a wrong building. I'm not sure where you might have needed to go for your blood test. We are working on signage. Being a new building, we recognize that we do need to get folks to the right place at the right time. So we really appreciate your feedback, and I will take that back to our teams as we're looking at signage for both of those buildings, and actually I would say all three buildings, including our Etobicoke Wellness Center. So thank you very much for your feedback.
Thank you, Anne. Our next question comes from Diane, who is also joining us on the phone. Diane, go ahead. Welcome.
Thank you very, very much. I've got, I just had surgery for lung cancer, stage 1, and I've got non-Hodgkin's lymphoma. Now, I'd like to go back to this lady that called about the emergency department and the doctors there. Well, after I had my surgery, my oncologist was away, God love him, and I went to emergency. I got booked in and everything, so nice. I got checked for the COVID, and they took me through. I put my paper in, and this one doctor, he was so wonderful. I got my urine test. He gave me a CAT scan, and he even gave me a coffee, if you want to believe that. That's the first in emergency. So I do not like to hear people putting the emergency department down. We should be damn lucky we have that. With all the COVID, with all the deaths, with all the nurses getting burnt out, the doctors, what do they do with their families? They walk out the door and they don't know when they're coming home. Now, that lady, I'm sorry about her friend having an accident. Why didn't she make the phone call, not the friend, about the emergency department? You know, it just bugs me. And then they complain about wheelchairs. To hell, when you go to emergency, that would be the last thing on my mind is a wheelchair. Please, could I get booked through and go and see a doctor? Or a blanket. Bring your own blanket if you're cold, which you should, if you feel that way before you go to emergency. Like, it's not a hotel. Now, I'm sorry about the lady that called with her friend and that, but there is nothing wrong with that emergency. I live behind where the other little hospital's built here, behind me at Center, and I go to Brampton Civic.
Thank you so much, Maureen. I'll pass that comment on to Kiki to respond to.
Thank you very much for your kind feedback, Diane. And that feedback is just as important as any other feedback we receive, and we are very grateful for that. Thank you.
I apologize, Diane, for mixing up the names. Thank you, everyone, for your insightful questions tonight. Just a reminder that if we weren't able to get to you tonight, we are gathering your information so that we can get back to you and answer the questions you have as best we can. I will now pass it back to Kiki for a few additional remarks.
I don't think you can get rid of me tonight. Thank you, Gurjeet. Hello again, everyone. I would like to take a minute to recognize tonight's moderator, Gurjeet Kaur Bains, and the other valued members of our Osler's Patient and Family Advisory Council. Patient and family advisors ensure that the voices of patients and families are part of Osler's decision-making. Their role is a voluntary one, and we are so grateful for their expertise and insights. As patients, family members, and the community, your care and experience must always be at the heart of everything we do. As a hospital caring for some of the most vulnerable enter our sites against COVID-19. Vaccination and following all safety protocols continue to remain our best defense. At this time, proof of full vaccination against COVID-19 and hospital-issued masks continues to be mandatory for all Osler visitors and essential care partners. We know firsthand the positive impacts that family presence has for patients and are happy to share that we made some recent changes to the number of visitors who can visit. At Osler, patients that need additional care are often supported by an essential care partner. An essential care partner is different from a visitor. Along with an essential care partner, each inpatient can have up to 2 visitors, although only 1 visitor at the bedside at a time per day. We have also increased the number of visitors and the length of time for those patients that are receiving palliative care and who are unfortunately at end of life. I encourage you to check Osler's website to schedule a visit and for the latest information before you visit the hospital. Please remember that patients do not need to be vaccinated to seek medical care. We continue to offer high-quality care to every patient who comes through our doors, and it is a safe place to receive care. Thank you, everyone. I will now turn it back to our moderator, Gurjeet.
Thank you, Kiki. Before we move on to our final polling question, I would like to introduce Ken Mayhew, Osler Foundation's President and CEO, to say a few words. Welcome, Ken.
Thank you. Good evening, everyone, and thank you, Gurjeet, for doing such an excellent job again tonight. My name is Ken Mayhew. I'm the President and CEO of William Osler Health System Foundation. The volunteers and team at Osler Foundation work with community members like you to raise vital funds to support Osler hospitals. Many people don't realize that 100% of the equipment in our hospitals must be funded by the community, as well as 10% of construction costs for redevelopment projects like Peel Memorial. That is why your support is essential, so that we're able to continue to provide quality health care close to home. And if perhaps we didn't appreciate the importance of that before the pandemic, we certainly do now. As Marianne noted in her question a bit earlier, we have significant needs right now, which is why we're working with our community to raise $10 million through our Build Back Together campaign to support the pandemic recovery efforts across Osler that you heard so much about this evening. These funds will be used to purchase surgical equipment to help our hospitals meet the tremendous demand following 2 years of the COVID-19 pandemic. And at the same time, we're excited for the transformation of Peel Memorial into Brampton's new hospital and are looking forward to our next fundraising campaign to support this and all of Osler's vital redevelopment projects. And we need your help. Each and every one of you on this call plays a critical role in healthcare in our community, and I'm grateful for your past support and encourage you to continue contributing to our hospitals. You can visit oslerfoundation.org, that's oslerfoundation.org, to donate and learn more about what your gift will mean and how it will touch our entire community. And while you're there, please sign up to receive our newsletter to stay up to date on our progress and to read inspiring stories about people from right here in our community. We're deeply grateful. Quite simply, we cannot do what we do without you. Stay safe, stay well, and thank you for all that you do for us.
Thank you, Ken. I know I speak for everyone when I say we very much appreciate everything the Foundation does for our hospitals and, in turn, for our community. Thank you to all of our speakers for your important updates tonight. It is really appreciated by the community. We have one final polling question to ask you tonight, and we would appreciate your feedback as it will help us plan future Osler events. To answer the question, please press the number on your phone that corresponds with your answer. Our third and final polling question today is, did you find tonight's telephone town hall informative? Press 1 if your answer is yes, this has been informative and I plan to participate again. Press 2 if your answer is somewhat, I found tonight's event fairly helpful. Press 3 if your answer is no, I didn't feel it was informative. Press 4 if your answer is I'm not really sure. I'll repeat those options. Did you find tonight's telephone town hall informative? Press 1 if your answer is yes, this has been informative and I plan to participate again. Press 2 if your answer is somewhat, I found tonight's event fairly helpful. Press 3 if your answer is no, I didn't feel it was informative. Or press 4 if your answer is, I'm not really sure. I will now turn it over to Dr. Martino for some final thoughts.
Thank you, Gurjeet, for moderating tonight's telephone town hall. You've once again done a wonderful, outstanding job, and we appreciate the tremendous contribution you continue to make as a member of Osler's Patient and Family Advisory Council. Thanks also to Linda Franklin, Vice Chair of Osler's Board of Directors, and Ken Mayhew, Osler Foundation's President and CEO, for being here this evening. I also would like to thank my colleagues, Kiki Ferrari and Ann Ford, for providing updates and answering your questions. Tonight, we have reached almost 7,000 households throughout the hour. Wow. Osler appreciates your participation, and thank you to everyone who submitted questions and comments. We will be hosting another Osler telephone town hall in the coming months, and we hope you can join us again for that particular event. We're in exciting times for Osler, with many important transformative initiatives for healthcare at our doorstep. And it reminds me, and I'd like to share the comments of Marie, and her name isn't Marie because I didn't ask her permission, so I'll call her Marie. She was talking to her newborn, Michaela, and this happened a few weeks ago, and she said, "Sweetheart, maybe someday you'll study at the Toronto Metropolitan University Osler Medical School." That was quite touching. So on behalf of our staff, physicians, and volunteers, our deepest thanks for your ongoing support of Osler and our healthcare teams. Have a great evening, everyone.
This wraps up Osler's Telephone Town Hall. Thank you, everyone, for your great questions and active participation. If you have any questions we did not get to, please email them to publicrelations@williamoslerhs.ca, and we will respond to them in the coming days. Once again, that's publicrelations, one word, @williamoslerhs.ca. Thank you again for joining Osler's Telephone Town Hall tonight. Enjoy the rest of your evening. Good night.